The journey towards extubation starts immediately after the intubation of every patient. But did you know that 23% of all mechanically ventilated patients develop ARDS, which might be a consequence of ventilator-associated lung injury? 40% of all ARDS cases are not being diagnosed by the clinicians. Mortality of ARDS is up to 45%, depending on the severity of ARDS. But how can I detect and minimize the risks of VALI development? Finding the best ventilation therapy and stabilizing each individual patient is a true challenge. Wouldn't it be nice to have a guidance through this journey that allows to visualize the adverse effects of mechanical ventilation and help us find the best course for our patient? But the route from intubation to extubation is rarely a straight line. In reality, there are many factors which might cause ventilator-associated lung injury, which must be circumnavigated. The main drivers of VALI are overdistension, collapse, and cyclic opening and closing of alveoli. With conventional monitoring, the extent of these adverse effects is often invisible. Thanks to the cooperation of Evita V500 with PulmoVista and the approach of image-guided lung protection, it is possible to analyze the lung's response to different ventilator settings, such as airway pressures. With this information, it is possible to treat the unseen. It is possible to identify a compromise between alveolar overdistension and collapse for each individual patient. With a few adjustments on the ventilator Evita Infinity V500, the course of action can be optimized. So, the safest route to extubation always remains in sight. A lung protective ventilation strategy aims at minimizing stress and strain within the lung. Image-guided ventilation therapy allows to see overdistension and collapse in real time and to set the right course for our patient. In this way, the safe harbor is reached while protecting the lung. Image-guided lung protection with the Evita Infinity V500 and PulmoVista 500 allows finding a compromise to minimize VALI and to adjust the ventilator settings accordingly. Image-guided ventilation therapy helps reduce ventilation-associated lung injury and can improve ventilation with lower driving pressure. Learn more about image-guided lung protection on Dräger.de.